Welcome back, everybody, for another deep dive. This time, we are talking all about omega-3 supplements and their potential impact on heart health. You sent over an article titled, Are Omega-3 Supplements the Key to Better Heart Health? And I think this is something that a lot of our listeners will be interested in. So
Absolutely.
let's separate facts from fiction, right? I mean,
Yeah.
omega-3s, everybody's heard of them, but what's the real story? I mean, we know they're essential fatty acids that we can get from our diet or from supplements, but today we are focusing on their connection to heart health. So let's just jump right in. One thing that I always get confused about is all the different types of omega-3s. There's EPA, DHA, ALA. What's the deal with all those acronyms?
Well, EPA and DHA are kind of the rock stars when it comes to heart health,
Okay.
and they're primarily found in fatty fish, so that's why fish oil supplements are so popular.
Okay.
ALA, on the other hand, comes from plants like flax seeds, but your body has to convert it into EPA and DHA, so it's not quite as efficient.
Okay, so fish oil is probably the go-to for most people. But how do these omega-3s actually benefit our hearts? Like, how do they work?
Well, one of the most significant ways is by reducing inflammation,
Oh, okay.
which is a key driver of a lot of heart issues.
So omega-3s are like these little firefighters calming down those inflamed arteries.
Yeah, I like that analogy.
Yeah.
They also improve blood flow
Okay.
by stabilizing your heart rhythms, lowering triglycerides, and even preventing plaque buildup.
That's incredible. And what about blood pressure? I hear omega-3s can help with that too.
They boost nitric oxide, which relaxes your arteries, and that helps regulate your blood pressure, which can be really helpful for people with hypertension.
It sounds like omega-3s are like a multitasker for heart health. But is all this just hype? Or is there actual scientific evidence to back it up?
There's a ton of research,
Okay.
a large body of research that supports the benefits of omega-3s for heart health, and numerous studies have linked them to a reduced risk of heart disease.
Okay, that's reassuring to hear. Anything specific from the research that really blew your mind?
Well, one study found that people with higher omega-3 levels had a significantly lower risk of sudden cardiac death.
Wow, that's powerful stuff. So we're not just talking about preventing minor issues, we're talking about potentially life-saving benefits.
Exactly.
So we've talked about inflammation, blood flow, and blood pressure. Are there any other benefits of omega-3s that we should be aware of?
Yeah, definitely. Cholesterol management is another area where they really shine.
Okay.
They've been shown to lower bad LDL cholesterol while raising good HDL cholesterol. So kind of a double win for your heart.
I've also heard that they can help with triglycerides, which can be a concern for some people.
Yeah.
What can you tell us about that?
You're right. High triglycerides are a problem because they contribute to the hardening of the arteries. But omega-3s, especially the ones from fish oil, can help lower triglyceride levels.
Oh, wow.
Some studies have shown a reduction of as much as 30%.
So it sounds like whether you have existing heart issues or are just trying to be proactive, omega-3s could play a valuable role.
Absolutely.
Ah.
They're not just for treatment. They can be a powerful preventative measure, especially for those with family history of heart disease.
Okay, so we're convinced about the benefits. Now let's talk about where to actually get these omega-3s. I'm guessing food is the best place to start.
Always.
Yeah,
Ideally, we would get all of our nutrients from a balanced diet.
right.
Fatty fish like salmon, mackerel, and sardines, they're all packed with EPA and DHA.
Yeah.
And then for people who don't eat fish, there are plant-based sources like flax seeds, chia seeds, and walnuts. But keep in mind, those provide ALA, which is, remember, not quite as potent.
Right, that conversion thing. But let's be realistic, not everyone loves fish or eats it frequently enough to get sufficient omega-3. So that's where supplements come in, right?
Right, exactly. Supplements can help bridge the gap, especially for people who need higher doses or who just don't consume enough of those omega-3 rich foods.
Great. So when it comes to choosing a supplement, what's the best way to navigate all the options? Should we be going for fish oil or plant-based?
Well, fish oil is generally considered the most effective just because it has that higher EPA and DHA content. But for vegans and vegetarians, algae-based omega-3 supplements are a good alternative.
Okay. And what about dosage? Is there a standard recommendation?
Yeah, 250 to 500 milligrams of combined EPA and DHA daily is what you'll commonly see recommended, but the optimal dosage can vary depending on your individual needs and health conditions.
Okay. So it's always a good idea to consult with a doctor before starting any new supplement regimen.
Absolutely. They can help you determine the right dosage and also consider any potential interactions with other medications you might be taking.
Great advice. And speaking of potential downsides, are there any side effects we should be aware of with omega-3 supplements?
Generally speaking, they're pretty safe. but some people might experience some mild side effects, like nausea, a fishy aftertaste, or maybe some bloating.
Ah, yes, the dreaded fish burps. Any tips for minimizing those?
Starting with a lower dose can help,
Okay.
and taking the supplement with meals.
Okay, good to know. Any other advice on choosing a high-quality omega-3 supplement?
Look for supplements from reputable brands,
Okay.
and check for third-party certifications, like IFS, the International Fish Oil Standards.
Oh, okay.
This certification ensures that the supplement meets certain quality and purity standards.
So it's like a seal of approval for omega-3s.
Exactly. You want to make sure you're getting a safe and effective product.
Okay, I think we've covered a lot of ground here. We've talked about the different types of omega-3s, their amazing benefits for the heart, and even how to choose a quality supplement.
Yeah, I think it's pretty clear that omega-3s are a valuable tool for supporting heart health. But what I find really fascinating is that research is still uncovering new potential benefits that go beyond just the cardiovascular system.
Oh, wow.
Who knows what we might learn in the coming years?
That's what I love about science. There's always more to discover. But before we get ahead of ourselves, let's just take a moment to recap the key points here for our listeners.
Sure. It all starts with understanding that omega-3s, and especially EPA and DHA, are essential for heart health. They work in all these different ways, reducing inflammation, improving blood flow, regulating blood pressure, and having a positive impact on cholesterol and triglyceride levels.
Right. And while getting omega-3s from food sources like fatty fish and certain plants is ideal, supplements can be a convenient way to bridge the gap, especially for those who, like we were talking about before, who don't consume enough omega-3 rich foods.
Exactly. And when choosing a supplement, remember, quality matters. Look for those reputable brands, those third-party certifications, and consult with your doctor to get those personalized dosage recommendations.
This has been incredibly insightful so far. But before we wrap up this part of our deep dive, I'm curious, are there any areas of debate or controversy within the research on omega-3s?
That's a great question, and I think it's definitely something for our listeners to be aware of. So, while the benefits of omega-3s are well established, there's still some ongoing debate about the optimal dosage.
Okay.
Some studies suggest that higher doses might be needed for specific conditions,
Okay.
while others caution against exceeding the general recommendations, so it's not really a one-size-fits-all situation.
Got it.
Individual needs can vary a lot based on things like diet, lifestyle, and your overall health. That's why it's so important to work with a healthcare professional to figure out what's best for you.
Yeah, and of course we should always approach supplements with a healthy dose of skepticism and do our own research as well.
Absolutely. It's important to look at the information out there with a critical eye and not just rely on marketing claims.
Okay, so the takeaway here is that while the science on omega-3s is promising, there are nuances to consider,
Right.
and personalized guidance from a healthcare professional is really key. This has been such an engaging discussion so far. We've delved into the science, we've explored the benefits, and even touched upon some of the debates surrounding omega-3s. Stick around for part 2 of this deep dive, where we'll continue exploring the world of omega-3s and their potential impact on your health.
Sounds good.
So we've covered a lot of ground on the science behind omega-3s, but I'm curious, are there any myths or misconceptions that you often encounter when you're talking about omega-3 supplements?
Oh, there are definitely a few. One of the most common ones is that all omega-3 supplements are created equal,
Okay.
which is not true at all.
Mm-hmm.
The quality and sourcing can vary a lot, and that can really impact their effectiveness.
So it's not as simple as just grabbing any bottle of fish oil off the shelf.
Right, exactly. It's like with anything else,
Yeah.
quality matters. We were talking about the certifications earlier, and that's one way to help ensure that you're getting a good product.
Right. What about dosage? Are there any misconceptions around that?
Oh yeah, for sure. I think a lot of people fall into the trap of thinking that if a little is good, then a lot must be better. But that's not always the case, especially with omega-3s.
Oh, interesting. So mega dosing isn't the answer.
Not usually.
Yeah.
Exceeding the recommended dosage can actually lead to some not so pleasant side effects,
Mm.
and it may not even provide any additional benefits.
Okay. So it's really important to stick to what your doctor recommends, right?
Absolutely. It's always best to err on the side of caution.
Right. Another misconception I've heard is that omega-3 supplements are like a quick fix. You can just pop a pill and erase all those years of maybe not so healthy habits.
Yeah, there's no magic pill, unfortunately.
Right. It's not a get out of jail free card for a bad diet and lack of exercise.
Exactly. Omega-3s can definitely offer some amazing benefits, but they really work best as part of a holistic approach to health.
Right. It's all about creating a healthy lifestyle overall.
Yeah, exactly. Eating a balanced diet with plenty of fruits and vegetables and whole grains, regular exercise, managing stress, getting enough sleep, all of that plays a role.
Okay, so we've busted some myths and emphasized the importance of that holistic approach. Now let's get practical. If someone is listening and they're thinking, okay, I want to try omega-3s, what are the first steps that they should take?
Well, step one is always talk to your doctor.
No.
And they can really help you assess your individual needs and consider any potential interactions with any medications that you might be taking and help you figure out the right type and dosage for you.
Personalized advice is key.
Absolutely. And then once you have that guidance, you can start looking at your options.
Yeah.
If you enjoy eating fatty fish, incorporating that into your diet a couple of times a week is a great way to start.
And for those of us who aren't huge fans of fish or maybe need a higher dose, supplements are a good alternative.
Right. And just remember, quality matters when you're choosing a supplement. Look for those reputable brands and those third-party certifications that we were talking about.
Okay, and we've talked a lot about fish oil, but what about those plant-based options, like flaxseed oil or algae oil? Are those just as effective?
They can be good alternatives, especially for people who are vegan or vegetarian.
Right.
But it's important to remember that they provide ALA,
Oh, right.
which, as we discussed earlier, your body needs to convert into EPA and DHA.
Yeah.
And that conversion process is not always very efficient. So you might need to take more to get the same benefits.
Okay, interesting. So it's something to keep in mind when choosing a plant-based option.
Right. Always a good idea to read those labels carefully
Yeah.
and understand what types of omega-3s you're getting and where they're coming from.
Great advice. So we've covered so much on omega-3s, from the science to some practical tips for incorporating them. As we wrap up this deep dive, what final thoughts would you like to leave our listeners with?
I think the most important thing to remember is that omega-3s are not a magic bullet.
Okay.
They're a valuable tool to help support your heart health and overall well-being, but they really work best in combination with a healthy lifestyle.
It's all about taking that proactive approach to your health, making informed choices, and seeking that personalized guidance from a healthcare professional.
Couldn't have it better myself.
It's amazing how much there is to learn about something as seemingly simple as omega-3s.
I know, right? It really shows you how complex our bodies are.
Exactly. And speaking of connections, we've been focusing mainly on the heart health benefits, but I know that omega-3s have been studied for their potential in other areas as well.
Yeah, for sure. That's one of the most exciting areas of research right now.
Oh, really?
Yeah, there's growing evidence that omega-3s could play a role in brain health, like supporting cognitive function,
Okay.
and maybe even reducing the risk of certain neurodegenerative diseases.
So those omega-3s might be good for more than just a healthy heart. They could be brain boosters too?
Potentially. And there's also research on their role in reducing inflammation throughout the body,
Okay.
which could have implications for things like arthritis
Wow.
and even some types of cancer.
It sounds like we're only just scratching the surface of what omega-3s can do.
Yeah, exactly. It's a fascinating field with a lot of promising research going on.
It makes you wonder what other discoveries are out there waiting to be made.
Well, I think we've covered a lot of ground today. We've explored the science behind omega-3s,
Mm-hmm.
we debunked some common myths, and we even touched on some of those really exciting potential future discoveries.
Yeah, it's been a great discussion.
It has.
And I hope our listeners feel like they can really take charge of their health now.
Absolutely. And remember, everybody, this deep dive is just a starting point. We encourage you to keep learning about this topic, do your own research, and most importantly, talk to your doctor to get personalized advice.
Yeah, well said. It's all about being proactive and informed about your own well-being.
Yeah.
Exactly. And who knows, maybe we'll have to revisit this topic in a future deep dive as new research comes out.
Sounds good.
The world of health and wellness is constantly evolving, and we're here to help you navigate it. Until next time, stay curious, stay informed, and keep those hearts and brains healthy.